Oh no.
Atete call be a buy. I was a Zipline officer. I was Vobsiha. A come here say, na a you winning quantity beer. And here say, a man named Ma 1 hour say, a swan. Sim no any abrepa. Sinebeya, obet me a diagi patient no one. Sending was a shayetian, and they say a bruise manso. Now request her a between them. With this,
we have very
your breast say you do so. I check crying, I was say yes, manson. Your sections me, back on the fulfillment area, and a flight off area. Fulfillment area or no. A honor in a package BBI. I was Simami and Santen. And a flight off area honor so. Your Simami, you know, I was see a dear BBI. It is Simanum Elco in Sumichino. Near ye BBA, I was a copy BIS as a cop.
In no one my request no. We have the shelf and refrigerator. Now what do one batch numbers no? A go computer so. Was shall see a drum. No, I should show who I share. Now, fee, what the car parachute, a car special packaging box. What the new abonnement drum home, a free fulfillment area hall, at the flight of area hall. Now a took what I sabia, one me here. Why you shame will be a ya, as a drone no echo draw. Ghana Civil Aviation Officer, I want Tamale, I'm on clearance, will bet me a year too.
On the average, we make around
that Koyanye deliveries crano. It me ye bay or her. A da ye bay busy panso. It me fly in draw any a card ye bay 150 airco. A da habe ship paso. It me share a yaresabia bay. Eduanai eko eduanum na wotwe ntemu no ayaresabia beye edioson eko edioson son ena na wotwe ntemu no omofre epeye mo a
drone way and am council eko Kubori Health Center ewo Mampurugu Magduri Mensinim ewo North East Mantam.
Getting into Mampurugu
so ko Mampurugu Magduri na se wo free tamalia obefa boga no afa na vrongo na ofri bisi akosa ndema na se na wakosa mensin eno beye do hwiri nsia isan se ekwan na nye kra nanso ye drones yi die simadua asam ye nu ntem na kodru ayaresabia horo no na wonsa aka indra ohia no
simadua santempe ye hu drone no ewo Kubori wiem simam ye nu akire no ne fa ayese parachute no ebie na inu ewo mu no eto fem.
Because their last mile distribution hasn't been done to them.
Isan se bosumi etwemu no deliveries of muhiania from Momunti. Ama a draw who are quite ho. You deliver in Ruby to say paracetamol tablet. Any in Ruby to say antiretrovirals, vaccines, moja, BBBI ye de common. It's so muni in Rubia. I want to share a reform or
drugs to treat their patients.
Debia, I are sabia, I would what to say. Kubori Health Center, at the one in it to do so, send a bay a bebon, I'm a patient on a bahasino. Wabajuan, Emmanuel Awunitia, or a principal physician assistant, a kai bre and sana, technology way ebano.
Most of the time, we used to have shortage of medical supplies for not less than 2 to 3 weeks before we normally get our supplies. And most of the times, when clients come, there are certain medical products that even when you prescribe for them, they can't get it within the district to buy. Unless they go to Walwale or Sandema or Navrongo where they can get a pharmacy to buy those supplies. And you can imagine an emergency that you will need a medical emergency drug to save a life, that the person have to travel not less than 3 hours to Sandema or Navrongo before they could get those supplies for you to save a life. It used to actually affect us greatly. And actually we used to lose a lot of lives due to these kind of difficulties that we used to face during those days.
Na sabu sumi supply na eyo how kesiye pa edema ayasabi eni adishia wonu esho won. Emre ekune nimiye. Technology etimi esiesi saa hawi. Eno wane se wote on Vobsi office ho. Drones no etimi hwe aresabia baye ahenu eduonu nsia. 256. Eda ejuma baba pa no. Etimi hwe aresabia baye 500.
As you know, we have 4 centers now supporting parts of the country. They've done supporting currently about 1,000 facilities, and they have delivered more than 2.8 million supplies across these centers.
So we are building gradually and strengthening our health systems, and I believe that equitable distribution of equity healthcare delivery will soon be achieved with some of these interventions. So the drone system is also another, milestone that we have chalked, and it's helping us quite a lot, and we are making strides.
Vice President Dr. Muhammadu Baumia say, "We ni sentia abanu ya nadwin say obama technology we ayeduma."
We have a major challenge in Ghana, in many developing countries, and that is the problem of remote areas. If there is a snake bite and you need snake serum, how long would it take for that to get to you if you don't have a hospital nearby which has the stock? You may even have a hospital nearby and you may not have snake serum. If a woman is about to deliver and needs blood, moving from maybe islands in Afram Plains, how do you get the blood supplies when you need to go by canoe and all of that? It becomes very, very difficult. So we have been thinking of how to address these problems, and we found out about the Zipline technology.
Wakubori Health Center no enu awoni eni apemfo apomodi a eni enyan ni nyina ya ade a etwemu.
Before Zipline, the kind of emergency drugs that we used to lack, and it was actually impacting negatively on our services, used to be drugs like oxytocin that we use to control postpartum hemorrhage after delivery, basic anti-malaria drugs that we use to save malaria cases from deteriorating, and most of the times even it used to also come to a point that we used not to have even basic medical logistics like paracetamol for children, that's a shrub, even at times diazepam, what we use to control convulsions anytime that a child is attacked by convulsion. These are some of the things that we used to like. But now that Zipline services are in the system, what we only need to do is to place a call, or we send a WhatsApp message to order for whatever we need in the next 45 or 30 minutes, and we take delivery of that.
Vobsi Zipline office no ewo North East Mantam Mantam baako a nansenya nsuyiri ha won pa nkrobe ya oha ene nsuyi Agyapong so a adehye be du baako nso efemu eto ananum ewo nsiado Tilomumbu a North East Regional Minister.
It's like God loves Ghana more than any other country in this world. If we didn't have these drone services in the Northeast region during the peak of the floods, I don't know what would have really happened.
Vobsi Zipline Center, and only Zipline officer, a whole airshipper, and so September Busumi Chumuya, and Abino Ebiano.
The fact
The
that
sun so be a bagre dam ninti. Any insua a toyen. Ama ayaresabia ahodo na obi ntumi nko. We enam so ama Central Medical Stores no. Deliveries a ewo so omoye ne last month no. Omu ntumi nyeye. Eno nti ayaresabia ahodo yi. Jen na ewo so omodan.
That is where we're flying these drones across Northeastern region where the floods affected most. We could send in our vaccines and anti-snake and blood when they needed them.
Almost every day, they had to get this to be able to save people's lives. Whether midnight, whether in the daytime, whether whichever time it is, it was the drone services that was used to save lives.
looking back, there seems to have been some foresight on our part to leverage on technology. And this is why, I believe that developing countries have more to gain, the upside, using technology than even the developed countries.
As I speak, Ghana has the largest drone service and drone center in the world. And I sit on the Global Vaccines Alliance group, I sit on their board. And they supported partially Zipline with Global Fund, these big donors in health with WHO. When I go to board meetings, my shoulders are like this, because they haven't seen that sort of initiative and boldness on the part of our president and his vice.
You only need to have a better picture of it when you interview somebody like Dr. Isabella, who is the medical superintendent at the Baptist Medical Center, that needed blood to save a woman's life at midnight. And when she called the Zipline Center, within the next 30 minutes, it was available and this woman's life was saved. Anytime I go to the Baptist Medical Center, Dr. Sile doesn't talk about anything apart from these drone services.
Team Aba Baptist Medical Center, Ewana Lerugua, North East Region Coupon, Ebeyen Shemu, Afanyo Oswafon Editujano.
We use Zipline.
Yeah, the Zipline, Edijuma Hudo Bebre. Omo the vaccines Ebrayen, Enru, Mojanso Ekahumbi. Any ayarisa akadebia ehun ayedin wahase every bia ye be make request no omuba omu hu boden ebesomye be don shrink tem no yensa etimika ye deliveries
ne mantem so no editudwa no Dr. Isabella Amese esisudua.
Over here all we have
ahasai no ne etawo all blood every mra Zipline ebaye no every pia me here fresh frozen plasma no. Omo the brain. Omo the brain every tia we mu. Some refer patients are moja bontwa ewo mu. Edi omo akota male no. Meet me at na me hospital haya. Na ma show mu.
Enye won say afia. I sabiate me refer ni seni awo cases be nu. Edi akota male teaching hospital. We ya dia kaneno. Na entesa. We evolve si base a. Walwale no efriwa drone services no juma ewo omenako a ewo epoye mantemu mampon a ewo asante mantemu ene sehwiwi oso a ewo atoye mantemu. Zipline technology ama apomide nyumafo ewo harwon pa.
For me in particular in BMC
me tutu no ewo BMC no obi a omanfo bebre ni dame so no ebre ho hia me pa na Zipline ada romanti don shiri edurinu nine entem no nese me ye bia no metime ye mane broso esanse sese ye ni doctors ewa ha senti me kwa me doctor ni a me wa ha sei empempin no ye tai de ye ni to locum doctors so ema omo ebeboa me eto de bia ye nya omo ena eto de bi nso ye nya omo nti obeti asese omo frɛ me ha na we mu nso frɛ me ena memory nso ho nia pa kaneno na cases bi wo ho a obefeel say obesay mebebre wo ho na nso ebe wiase no wonya nso so pa bia eno ne cases a den a ye ta refer no say esan Zipline nti metimi nya ne mepe bia e de hwe sa patients no na necessary omo ward ho no omo nso monitor omo na we aboa me pa nti meni Agyapa say Zipline for ASA Jume.
Grace of God, it says that government has been quite far-sighted because some of the problems and challenges that we have introduced this drone technology to address, some of them many people could not see. In fact, when I was talking about drones and when the president was talking about drones, we had not really even thought about flooding. And what will happen in the case of flooding? People were asking, why don't you have ambulances instead? We say, well, we will have ambulances, but we need this to complement. But if there is a flood, How can an ambulance cross the road? All the roads are not possible. You can have all the ambulances. It wouldn't cross. So we have a mix of instruments that we can use to help the sick, to help the poor.
Apasema, efa anwasema ekoso Vobsi base hano. Oko centers ahodo na ensusuye bia enim. Ye adwen se ye beko omenako office no. Wosa center we no. Drones bi na wetu akọ aresabia ahodo. A di nnura hu hia ekoma won. Technology na say abefu aboa ama say drones no enam wiemu a unu nyina eni enam kwanso edi enu akọ na edi enu no nso akọ awie eni ne esan aba base ho sa base no drones need to share aresabia ahodo be ahasa eni eduenu 350 aresabia kesi wo health centers and a chips compound Samuel Akufu any fulfillment operations leader our say
the facilities are located
facilities in Dodonawo Eastern region and kakra bi nso wo Central region and kakraba bi nso wo Volta region and ibi nso wo Greater Accra region and your center konso wo Noguchi
in the Greater Accra region, and then we also have Noguchi, which is the stand-down site that we use for delivering COVID-19 test samples.
If you remember what she won't do media said, center wing kwa I deliveries by in Pemukon 9,000 and 59,000 units of medical products and what they are supply.
Because of the unique nature of our operation, we serve as more of like a buffer.
O Sunday, Hinejuma no or unique accrantee. Yes, serve today buffer. Dema regional medical stores. Enuka crowd wono. Wama yembi. Na soko bande facility bi edru anade bibi sanhwa na yakọ fill them gap no damon. Onu ntonyaza obesi de hospital bi beka de onyedru anade edru won orisa. O Sunday otomo yetin kra Zipline yebema won bi.
They are confident that Zipline will fill in the gap for them.
The centers that they have put is also serving as warehouse storage places for us. Our vaccine storage system is not very strong. They are now storing some of our vaccines and blood in their warehouses that have cold stores because we store medicines there for emergency deliveries. And these are areas that we are now utilizing as part of our supply chain system. And it's phenomenal.
Tima one our say Ebwa Bong, Sinebeya, Obetu drones kakra, Aqua Aresabia be 350. Sad drone way and council airport Apodum Health Center. Now if we omanako Zipline office now what is shame moi. Don't shrink. Don't see nam council the Apomedia Cadebia and we hear air come.
So the facilities request for vaccines.
Anonti facilities we requested with the vaccines. What the immunization? Wasanaje anti-rabies, anti-snake. So when emergencies are, after so wasan requested for anti-malaria medications. And inswa was it Nipanado. Now so miss my ejuma yen otinti. Yetumi yejuma ohardo. Anti-snake, anti-rabies naden. Yetumi de come on pa. Osande inedura. When intentem. As one couldn't tema. Semape patients ni bit mashenunkwa.
In a matter of seconds, the patient may lose their life, so we are better placed to be able to send those. So we get quite a number of those orders.
What akwadumuno? What brand na ye chen e was our parkway so. Ye wo drone e wo wie. Ye kata ye ni bie ya. Na aye kadwa ebe deliver package a what they asuma no. Denis ni allote a community health nurse. E wo ha say.
Before Zipline, we used to order drugs from the
Ansana Zipline ebeba na your order endro a free medical stores. Na se kobase asan anase aseya. Na wo say fa motorbike edikoko anase ye mainstream. Na yakope endro ni bi ato. Emergency drugs no. To de bia aya na ebi ni ho. Eno nti e wo say ye refer omo akufo-addo regional hospital. Nanso se sia no esan Zipline service nti. Ye nye sa referrals ni bi. Eno anu say endro na ye pe no ye be order. na 10 to 15 minutes no yen saka.
Dennis eni agisa technology yon pa. Titire ne apemfo ya rehwem.
The labor ward sometimes.
Wo bia ha ye ji awo no. Eto de bia yetiminia complicated cases anadu de so. Ananso se eto de bia numere kra. Eba ne sanso a ensem fata se ye be refer patient no. Esan tibia wo munenti. Entempa ne afre Zipline phone. Mamenka no kre Zipline for boy pa.
So they've been of tremendous help to us.
Physician assistants are all I say. Jeffrey Tinkrapa and so adan sa drunsi e de agin kwa bebre.
We had a case that we need an injection to give.
Yenya case bia na wo say ye wopani. Eye case bia opemfo bi eba ha say ya na ofepa eba ne sanso na ye nipa ne bia wo eno nti ye to mo nkra case foforo bi nso baaya na eye yefuyade a no odin e na afi nso ayemhwe eno nti na ye hia pani a ye de bewo oniekun ye to mo nkra.
If the person is vomiting is so severe,
so bi yefuya ne ya na osan afia ya pa ebema na hwere nsuo bebre e woni nipadie no se wodi nsuo krasi ni so a e wo se ope kwan bi so e ma afie no etwa na esanse na nroni bi eni ho no na e wo se ye dan Zipline for e ma omo ebeye ye moa enti Zipline die abeboa pa.
Pregnant women, one in Talensi, I remember, who was saved because they just were able to deliver blood to Talensi. Otherwise, the patient would have had to be moved to Bolga Hospital. And you know, when it's pregnant women who's bleeding after delivery, you have on average about 2 hours to survive. And so every minute counts.
A lot of people didn't understand what it was that we were going to do. The opposition was shouting, this won't happen, the drones will be this. So we fought the battle. And again with prayers and some good explanations and courage with the support from our hierarchy, the president and the vice president. When they are supporting you, you go with confidence, you know. So we got these things passed through parliament. And what the vice president said was that we're not going to use government money because opposition were shouting, blah, 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 blah. We managed to get it through parliament approved. So we started implementation.
Omanpeni abedi chwedie. So man from home ben ha ho and a share one crime and what is our drone technology a buy while brana omanfo bi empene so.
Unfortunately, when we brought up the idea of Zipline, there was a lot of opposition because many people didn't understand it. People thought that the Zipline was going to go around taking pictures of people in their bathrooms, you know. But today, the doctors, the nurses, because if you're a doctor or you're a nurse and you are in a place and you are watching your patients die because you can't have access to blood or some critical medicine, it's very, very disheartening for any medical practitioner. But with Zipline, you, at least for the areas that are being covered, you are just a phone call away and the medicine will be dropped right at your clinic.
Adaka wonu eshe enunu edugumuno. Watu amboase. E design ni yepa.
Our drones do not land. So the drones
say drones no code location wa or drop packaging. Na packaging na koto form. Inti packaging no they are not. No weighting obebe 2 kilos. Ena or parachutes or nesoro. Parachuting ena omakwan ma boxing or koto form boko.
Much easier fashion so that there isn't any hard hit to the ground.
One centers are wood running in a more. Zipline at the one now. Where Adaka no contract. I'm a man for what is Sakura would do in Germany. Where a choir or so our own Juma aye. Now, Boma local economy no. A general naso, say community leader. Of your crew in Kabum. Vopsino, Simon Asano editing in himself. One of any bull sacra.
All of these has been assembled by local employees. So everywhere that we go to, we make sure that we employ local people and then we train them to be able to assemble these boxes. This contributes to the creation of employment around the communities where we serve. Beyond that, we also believe in the economic empowerment of local vendors. And so at Zipline, we care so much about our staff that we do not want service interruptions, and so we ensure that every staff member gets 3 meals a day. And so we've been able to outsource that aspect of the work to local vendors, and we have 3 vendors who supply us food every 2 weeks, and then another vendor comes on board. Outside of that also, we have certain types of works, menial construction works around, and then which we always outsource to local contractors to come on board. All of this, we believe that we actually devolving opportunity down to the local community members, and also empowering them economically to be able to create wealth for themselves.
COVID-19
With COVID, the drone started flying samples from the hinterlands to Omenako, and from there continued by road to Noguchi, so that they could test in good time to take results back. Phenomenal.
Adokota phone and nurse phone die won energy 70 say sene na wo refer ayerefo edeko ayeresabia esoso abafempa.
For example, if you are in somewhere in Sefiyo or so, or in Western North, and it takes you about 2-3 hours to transfer a patient from one place to another because the person needs blood. If the drone is able to deliver blood in 30 minutes, that means that you really don't have to. People just refer because we don't have this medication, or we don't have this, and they transfer. So with the improvement in supplies, and even where they don't have, they're able to deliver in a short time. It's still faster than having to move a patient. So that has significantly improved care.
Especially with the blood products, with vaccines, let's say...
Did you any blood products, no? Vaccines to say immunoglobulin. And then you can when you be no. So when you fresh Zipline for one sa ebekebi, now they are show patients no. So when you are ni hona and answer H-ring crampua, Zipline at the bebro, a banasa, and whom he say, who by refer patients no. I call Ayarisa Bia for Frubia. Inti ama cases I refer no, a swat pa.
Now,
a man for more in crew, I would do him. Or moon to quine encope Ayarefe. A son say Ayarisabia or Mumpotim. In Drobio being here piano. Drones no, a bit to me at the abrom. And also by Boama, a pomodin human for or more no, Ashon.
In Shemapa Eguapusua, drone service no ebe juma e my morning na.
We are hoping that next year we will have coverage for the whole of Ghana. Right now we have 4 main centers. We need an additional 4 centers for 100% coverage of all of Ghana, and I think it's very, very important. I hear a parliamentarian, in fact, made that request that we should get coverage for all of Ghana. And he wasn't an MPP parliamentarian, he was an NDC parliamentarian. And it's good that that thinking has changed about how helpful the drones have been. We are at a cutting edge of technology, and Ghana is one of the leading countries in the world.